All right. Welcome, friends, colleagues, students, citizens of the world. This is LeRoy Horton back at you with another episode. And I got a very, very special guest with me today. As promised, we're bringing experts from every single field. And it doesn't have to be the dental discipline or the world of periodontics or oral surgery. So we have today my very special friend, Miss Patience Karsten, who is a nurse practitioner in Eastern Washington who's doing some amazing things with platelet products. So I'll just let you do a quick introduction of yourself, Patience. Tell us the brief rundown on why you are so special as I think you're special.
Thank you. I'm happy to be here. My name is Patience Karsten, and I am a advanced registered nurse practitioner in
Uh,
the state of Washington. Yes, it is called
don't forget that.
ARNP. It's called ARNP, Advanced Registered Nurse Practitioner. We're family nurse practitioners, and I'm specialized in wound care. So I am specialized and certified in wound care and hyperbaric medicine.
Okay. Now, obviously, we know that nurses help people. That goes without saying. But within every industry, there's these niche needs that we all fall into, and you have fallen into the specific niche of wound care, specifically wounds that are either slow to heal or are non-healing wounds. Can you tell us about that evolution of your practice?
So before I became a nurse, I knew that I wanted to help people. And that's kind of like general, right? And then I knew that I wanted to go into medicine. And I started by becoming a nurse. And while I was a nurse, I decided to just go wound care because I loved wound care. I just see a lot of people, there are not so many people who like wound care. So, but I know that there is a lot of people who suffer from non healing wounds. And I said, okay, I think I would like to go into that. It became a passion. So everywhere I worked as a nurse, I want to go in as a wound care nurse, which I was until I went back to school for my master's. And after that, I said, okay, I want to become specialized in wound care. So I went after my master's as a nurse practitioner. I wrote my boards, everything. As a nurse practitioner, I decided I won't go family. I would just go and specialize only in wound care and hyperbaric, and just to help people, heal and find out why people are not healing. So it became a passion.
Well, what kind of patients have trouble healing? Is there a specific subset of patients that you see?
I see diabetic foot ulcers. I see venous pressure ulcers. I see even surgical, anything, say, for example, I see even dermatology patients. So when they go to dermatology, they are told, okay, you have to go to cancer hospital, say Summit in Spokane, and they go there, they remove, say they go undergo Mohs surgery, and they send them back to me to take care of them. Sometimes the wounds are, taking time to heal. Perhaps it might be due to so many other factors. It could be, say, the person has diabetes and not controlling so uncontrolled diabetes. It could be vascular issues. It could be they're not eating right, protein, all other stuff. There's a lot of reasons why wounds will not heal. They become chronic wounds, and then that's when they send them to me.
All right. So you're the Navy SEAL of wound care, right? So
That's
your
right.
average
I
doctor,
don't
average
see
nurse.
stage one, stage two.
Yeah.
I see stage three, stage four, and unstageable wounds.
That's amazing. So the reason I think I was drawn to you for this particular conversation is because I heard you say that as part of your wound care regimen, you use a lot of platelet products. And as we're talking, this is a podcast that's audio, but there'll also be a video version. I'll overlay some graphics and some pictures so that anyone watching can see what platelet products look like. But why? What makes platelets such a rich reservoir for potential healing?
So when patients come to me, I want to see, first of all, why is that one not healing? Why is it a chronic one? Another one big reason why it will not heal is because they might have tissues that are not responding to treatments. So as a result, I do go advanced treatments from there. And platelet-rich plasma is one of the advanced treatments that I do. So all I do is to just get down to their, I do phlebotomy, get their blood. And as you know, that platelet-rich plasma contains platelets, right? And these platelets, they release cytokines, okay? They release cytokines, and those cytokines stimulate epithelial cell regrowth. And also, they increase blood supply to that wound. So that's why I do like to do PRP for wound care.
That's and part of my explanation for how we use it in dentistry is very similar, right?
Okay.
A natural clot is maybe what 4 or 5% platelets and then mostly red blood cells. But when you're able to concentrate it, you can flip that ratio. So now, when you look at all the studies, a lot of these cytokines and growth factors like insulin growth factor, vascular endothelial growth factor, PDGF, right, platelet derived growth factor, we're augmenting them, sometimes 10 to 15 times what a natural clot would have. And so you're kind of super starting that healing process. Now, obviously you have to get training for this, and this may not be something that they teach in your everyday nursing program. So how did you stumble on platelet products specifically?
So, first of all, I do this and I also do cosmetics. I don't know if you know about Dr. Charles Ronalds.
Mm-mm.
Dr. Charles Ronalds, I went to see him, went through his PRP training in Alabama. With platelet-rich plasma can do so many things, okay? I do P shots for erectile dysfunction. I do O shots for, women to increase libido. I do breast lift. We call it vampire, breast augmentation or breast lift. I do facials and all that with PRP. And I was like, okay, if platelet-rich plasma could do that to help erectile dysfunction, I think I can do that to my wounds. And because of that, I started injecting that to the wounds, and it produced great results. Yeah.
Okay, that's awesome. In dentistry, and I think me and you were having this conversation a while back, there was an oral surgeon out of Florida named Robert Marks who kind of pioneered. He took PRP out of the orthopedic world and started formulating protocols for the dental world, the oral surgery world. And I'm old enough to know, or kind of been around when, to make PRP, you had to add a anticoagulant like calcium citrate, right? But now we have special centrifuges and protocols where in the dental world anyway, and I'd like to know what you do, we make both injectable PRF or what we call PRP and solid PRF or platelet-rich fibrin without any additives. So it's by virtue of using a glass tube with a high surface tension or a plastic tube with a low surface tension. At the same spin, you can get a liquid or a solid product. What does it look like for you when you create your platelet product? What are some of the spin protocols that you're using?
Okay. So I collect the blood, and before I do that, I'll have to add anticoagulant. And I add anticoagulant and I do draw the blood. After I draw the blood, I will just put them in the vials and put them in my centrifuge. I use pure spin. I have to because it's, how do you call it? Yeah, that's the centrifuge that they told us that you can use, and so I do use that. And then after that is I spin it for like a minute, and then I take out the platelets and the plasma all together, and then I throw away the red blood cells, and then I will spin the platelets and plasma again for 5 minutes. So when I spin it for 5 minutes, it depends on how much I need to inject. So what I am going to do is to take off as much as I don't need. I will throw it and then mix the other platelets with the plasma. the one that I need as much as I need. So that's what I do. So I actually need more of the plasma and some of the platelets, and then I mix both together and be able, but I need to separate the platelets and the plasma so I can get more of the plasma. So that's how I do it.
Gotcha.
And then I add sodium chloride.
Okay. So that's interesting. So we, even though we're using platelet products between the two disciplines, there's some differences, right? One of the things that I ran into early on was I feared that patients, and it might be more natural for you to get your blood drawn at your nurse's office, right? Or your doctor's office. But in the dental field, people usually don't walk in thinking someone's going to draw their blood. But as I started doing PRF and PRP, probably back in, geez, it had to be like 2012 or 13. Surprisingly, that because it was already present in the world of aesthetics, a lot of, especially my female patients, already knew about Vine Power facials and using your own blood for its benefits. When you come in and you see a new patient that has a non-healing ulcer, are they very accepting of these protocols that you're suggesting? What does that initial conversation look like?
So when patients come to me, I tell them before they come, just just be ready to be here for like 2 hours. The
Mm,
first visitation, the initial visitation, because we have to talk, because we have to do some exams, because if you're diabetic, I am going to be doing a lot of tests. If you have vascular issues, I am going to be doing a TCPO2. I'm going to hook you to the machine. I'm going to do all of them. While we're doing that, I'm going to be having conversations with you. I'm going to say, after everything, now I know your blood flow. Now I know your oxygen flow. If you have oxygen to your to that extremity or not. Now I know what to do.
mm,
And I have to talk to the patient and say, hey, this is what I like to do. And because this is now chronic, this is not acute. And because they have everyone who maybe the nurses or doctors who have already treated you, they have treated you to this extent is not working. Everything that they have treated you with has not worked. So if that's the case, this is going to be an advanced form of treatment that I'm going to give you. Do you accept this or you don't accept it? Because that's what I can give you. And every patient that comes my way wants to be healed. Everyone wants to continue life in a happy way. Like I tell people, I say, having a chronic wound or having a chronic or ulcer can, it can, I don't know, it can make people feel like the world is coming to an end. It's a lot of things. Like people might not be able to go to work as they should, and maybe there are parents and who have to like maybe their parents who have to take care of their children, of their babies or something like that. So because of their chronic ones, a lot of things, I don't know how to say this, they might not feel happy, they might not feel contented, they might not feel like the world is a good place for them to live. Their patients I talk to, and they be like, so I'm gonna have this wound for another 1 year. Why am I gonna have it? Why am I here? Like they're really tired of this world kind of thing. So they just want to quit. And I keep telling them, you will get better, you will walk again, you don't quit and stuff like that. So you're dealing with these patients' wounds, chronic wounds, you're dealing also with their mental health. So it's not just the wounds. So when they come in there, you're treating the whole person holistically. And so, yeah, they want to heal. So they will accept it. There are patients who don't like needles or injections or stuff like that. So with that patient, I don't inject. So I just place the platelet-rich plasma. I just place it on the wound, and there are other things I have to place on top of it to make it stay, so it doesn't, so you don't have it everywhere, just to stay on top of the wound, and then you put your dressings on top of it. So there are other ways to do it. You don't want to inject it, you can just place the samples, or you can just place whatever it is on top of the wound, and it stays there for another few days or 2 weeks or something like that. But for those that don't mind injections, because after all, I use curates, I use stuff, that are very, I can cut people and they don't care, they don't mind. And it depends too. You can also hold your needle and you say, I want to inject you. And they said, oh, but it's going to be painful. You have to inject them with lidocaine. There's a lot of things that you can do. People just, yeah, they're ready to get healed. So they stay, they wait, they say, yeah, go ahead. And if that doesn't work, you change maybe after about 4 weeks, then you change your treatment. So people want to heal. They don't
Yeah,
care. They don't mind.
that's interesting. The people that don't want to be injections. When I first came across platelet products, it was with lectures through this French medical doctor. He's, I think, a general surgeon named Joseph Chacroun. And we'd actually years later ended up hosting him for a big lecture and training session here in Seattle. But that's how he came across platelet products and the use of non-healing ulcers. But he would make the solid platelet clots and clean the ulceration, put the solid PRF in it, and then wrap it with Saran wrap, and then repeat that every 2 weeks. So it's interesting that kind of the evolution of platelet products. But you said something interesting. You do a holistic approach to your patient. And for all the dentists, dental students, wannabe dentists that might be listening to this, why is that so important? Because I preach that day in, day out. Even if a patient comes in for a missing tooth or a broken tooth or a hurting tooth, you always start from the outside in. Why is that so important that we holistically look at the patient systemically, not just for that particular wound or tooth that they're wanting to be addressed?
Okay, now I have never seen a patient, that'll come to me, having a dental issue or whatever, okay? But I will assume that if a patient has a problem with their tooth, they won't be able to eat. Feeding will be, nutrition will be an issue, okay? Smile. They will not love to smile, so they don't want to go out. They don't want to, talk to people. They don't want to interact, socialize. And we are human beings. We are meant to socialize. And so people don't want to do that. People will not eat well. They will not eat what they're supposed to eat and stuff like that. So think of all that. And if they don't have their proteins, they don't have what they need, they're not going to heal. So you want to look at those. You want to look at their mental health. You want to look at, that's a big issue right now, mental health. You want to look at their, everything. It has a lot to do. You want to look at their skin. Are they well hydrated? Are they eating well? You want to look at, that can affect if they're issues with their eyes, issue with their anything, bowels. Oh, I'm constipated, I'm having that. Yeah, if you don't take care of them like that, yes, they go downhill, especially if they are older adults, or children. So it's very important to look at the patient holistically. Like mine, take mine to be very, very serious, because many older adults have wounds. Some of them with lymphedema, some of them sacral wounds, some of them, some are diabetics, and it's a lot. So they have a lot on their plates. They can't even go anywhere. These are people, they were once, as like us, very young, and they socialize, they go out, and now it's like they're confined to a place, a bed, wheelchair, They can't go anywhere, they can't interact, they can't socialize, they can't. Just think about that. Sometimes I think I put myself in that place and I'm like, okay, I'm vibrant right now. What if I get to a point where I'm not able to, so I become very lonely, I become very, just think about it. And that's why they say that older adults think more suicidal than younger people. And that's a fact because, so you don't want your patient to be in that place. So that's why you think holistically.
Absolutely. And I would even add to that especially if you're in a procedural profession, like we're doing surgery in the mouth. If they're diabetic, if they're uncontrolled diabetic, that's going to affect the healing and the potential results, right? If they're on any slew of medications, they can be on blood thinners, they could be on corticosteroids or a chronic steroid regimen. It's very important for clinicians of any discipline to always look at the patient holistically. Now, so that's one end. So let's say we did our due diligence and we did a holistic approach or assessment of our patient. We came up with a treatment plan. One of the things in dentistry that is kind of the bane of our existence is patient compliance. In your world, how compliant are patients with your recommendations and your, dietary changes, medicine changes? How compliant are they on average? And how compliant do they have to be to really get the results that you're trying to do as far as healing a non-healing ulcer?
Patients have to be compliant. Anyway, however, not on average they are though. But on average they are compliant, but a lot of them are not. And so this is me because I know what I am doing, I know what I do work. I do let the patient know when they come to me or when I go to them. I tell them that initial visit. I say them and the caregivers, if any. I tell them, I say, look, this is what I see and this is how I'm going to treat. Are you willing to, do your own part? Because you and I have to do something. You have to do your part and I have to do my part. I'm not going to do magic. I'm not doing magic. If I'm helping you, you're helping me too to get to where we want to be. And I tell them that, and I am very firm. And I don't play. Because if I am doing something, if I am taking care of you, in a week I should know if what I am doing is going to work or it's not going to work. I'm not there to play. So I am very firm. I tell my patients, sometimes you just have to be firm. I'm very playful, very, very playful. But in the beginning, I just have to let you know that I am firm. And then from there we can start playing, okay? So anyways, many of my patients don't comply though. For example, there is a patient, I have been taking care of her, it's been 5 months. Now, I'm very patient with her because I want to do it. I want to heal her. She has ulcer to her sacrum. She's paraplegic, okay? So, and she likes to go out, like get on her wheelchair, go out, get on the bus, go to wherever, and shop, and she can sit on her buttocks for, I don't want to say her butt, on buttocks for, 12 hours.
Yeah.
So, and then I said, I need you to, change positions, and then we can change positions and then don't sit for too long, blah, 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 and all that stuff. She just started listening to me. And her wound is like this now, very tiny. Her wound used to be like this. Right. So, and then she was taking, she was Bisacodil, Senna, some other, and they were giving her diarrhea, and that wound was not healing. I had to stop Bisacodil. I had to stop Senna. I had to tell her you have to change it. Having said that, we have to be patient with them though. Sometimes it's hard to just, it's like you're talking to some, children. Sometimes you just have to bring them to, it takes a while to bring them to that place where you want them to be at. So, but what I'm trying to say is, it takes, the patient and you to heal them. So, but most of the time, they don't. You're not gonna do what are you gonna do?
What are you gonna do? You know, and that's a psychology of our culture that's very interesting because and you're from, was it Nigeria or was it Kenya?
Yeah, I'm from Nigeria.
Nigeria. And I was born and raised in Greece. So
Yeah.
I've seen multiple cultures, right? One of the things we come across heavily here in the US, for example, if you have a non-controlled diabetic that's coming to you for a non-healing ulcer, the fact that they're uncontrolled diabetic is proof positive that they're not compliant,
That's right.
right? And so you're not just treating the ulcer you're presented with. You're having to do a deep dive in the psychology of this person to be able to get them to be compliant. For instance, like the lady that you're treating in the wheelchair. Well, you also said that people are very social. So now you have to be able to get into her head and say, yes, you want to get out into the world. You want to be social, but you got to do it in this way with these limitations so we can get this ulcer to heal. Have you found that the American culture is less amendable to the recommendations of a professional than, say, in other countries? Are they more likely to listen to you as a healthcare professional in a different country than they are here in the U.S.?
They are less likely to listen to you.
Mm.
Well, yes, they are less likely to listen because everybody thinks that they know it even more than you do.
Yeah.
But in other
Dr. Google,
countries,
right?
yeah, but in
Yeah.
other countries, they're just happy that you're there to help them. They're just grateful to, whoever Almighty God or whoever that comes in, they think that you're their second God. God has sent you to come and take care of them. They can, whatever you want us to do, we'll do. Here, now, you know what the lady told me? She said, I don't have to offload for that to heal. You got to do what you have to do for me to heal. Like, are you kidding me?
You got to
No.
sprinkle some magic dust on it, huh? That's what she wants. Yeah.
That's why I'm telling you, I tell them in the beginning, that's why I'm strict. But in
Yeah.
Africa, where I come from, you don't have to be strict because everybody will follow everything that you say. The doctor says, don't do this. They don't do it. Because the doctor says, they see you as the small God, okay?
Right.
But, okay, so she told me, I don't have to. If you can do it, you do it. If you can't do it, then let me know. I'm like, yes. If you know that you don't want to do it, then I discharge you. Because there's no reason for me to be treating you and you're not healing. It just doesn't give me that joy. I don't feel like I'm doing what should be, because I've tried this and tried that and tried this and tried that, but it's not working. So if you're not trying yourself, and I just don't want to feel like burnout, like that's not me. So I say, are you willing? This is the treatment I have for you. Are you willing or you're not willing? A lot of them, when I go to them, especially in the adult family home, I just tell them this is what I want to do. Is he okay or not? They have to tell me because I'm the one who's driving to you. When I go to Seattle area, I'm driving to adult family homes. I don't want to waste my time. So, but when when they come to my office, I tell them that. I say, you don't have to waste your time if you're not doing your own part. You just let them know. You just let them know, and then, they know if they're going to come or not. We're not playing here. We're trying to get you healed.
Right. Amen to that. That's one thing when I met you a while back at the Black History event at PNWU. One thing that drew me to you was your passion about this, right? And a lot of people, I fear these days, are getting into healthcare because it's a flex. It's a way to make money and to have social status and to, you look at their social media page and it's only them in bikinis and on vacations, right? But you have a true passion for this. And I'm not going to keep you too much longer, but how do we instill or select for passionate future healthcare providers and not young people that have been mesmerized by the glitz and glamour of these healthcare, what I call healthcare rappers, right? People who, You never see a case, you never see a before and after, but you see them with jewelry and watches and fancy cars, right? How do we duplicate your passion in these young students?
So, I don't know how to duplicate that. It just have to come from the inside. It just have to come from, what gives you joy?
Mm.
What do you like doing? What do you like when you're doing it? You don't get tired of it, and that's me. So when you find that out, that this is actually when I'm doing this, it doesn't matter. I've been driving from here to Seattle area, from Yakima to Seattle area every weekend for the past 1.5 years. So I don't get tired of it. Yeah, every weekend I don't get tired of it. I enjoy it. I love it. That's when you find joy in what you do, that's the passion that we're talking about. That's And another thing is, if I, like I said before, if I see a patient, the first week, that wound has to start healing. It has to start healing. That's me. I'm not going to take care of you for another 1 year. It has to start healing. I will do everything that I can. I will change as much as I can. I have to change, treatments as much as I can just to see that wound heal. I've been called their second God here. I've been called all kinds of names for wounds that have not healed, or chronic wounds that, for more than 10 years or 5 years or what. But I give God the glory because I am not the one who just, okay, I put this and that and that and that together. People have been doing it and they were not able to achieve the goal that I am achieving right now. So I just, I enjoy it. That's the passion. So everybody have that passion. If what you're doing or what you're going into, you kind of don't find joy in it, it doesn't gross you out. Ew, no, so that's your passion. That's who you are. And you can even do it in your dreams and be smiling and laughing. People ask me, you do that for a living? Ew, you do, that's what, yeah. So, yeah, find where your niche is. Find what your joy is. And you love it. You love life. Yeah, that's it. Yeah.
Absolutely. And I love how you phrase that because I don't think there's as many. There's a lot of caring, compassionate healthcare providers. I'm not going to try and oversell that everybody's in it for the money.
Yeah.
But I feel like, you've been doing this for quite some time and you're still just as passionate about it as ever, right? And I hope that everyone that gets into healthcare finds that niche that sparks not only their interest, but their inspiration, their motivation.
Sure.
And especially when you think about how important the responsibility of being a healthcare provider is. And this is something where you don't have to be the best dentist, you don't have to be the
No.
best nurse or the best doctor.
Mm-mm.
But you have to truly hold dear to you the fact that every person that sits before you is someone's loved one, someone's child, someone's mother, someone's sibling. In the same way that at times we're sitting before somebody or our family members are sitting before a healthcare
Yes.
professional.
Yes.
And we want, if I have my choice, it's not the provider with the fanciest car. It's not even always the provider that had the 4.0. It's
Yeah.
the provider that is, yes, competent and knowledgeable,
Yeah.
but has a true passion to want to heal
Yes.
another human being
Yeah.
and honors that respect. Because, think about it. Someone is coming to you, patients, letting you give them advice, draw blood from their arm, spin it in a centrifuge, re-inject it, whether it's a wound or a private organ that needs a little help, right?
Yeah.
That is such a huge responsibility.
Yeah.
And I would only want to give it to somebody that I felt had the same type of passion that you exhibit.
True.
So I say thank you so much for coming on and sharing. We've already talked, and hopefully we do a second episode because I'm going to have you to come to one of my courses, and you can just kind of see a different perspective of PRF. And I'm hoping to come to your office and your place of work so I can see how you do. The best way for us to drive innovation and become better clinicians is to get out of our bubbles
Sure.
and to learn from each other because you have an expertise that I can't duplicate and vice versa. And so hopefully when we come back for the second iteration of this episode, we can maybe share and swap stories of what we saw in each other's practice. I think that'd be
That's
an
right.
amazing thing to share with our
That would
listeners.
be cool. Thank you
But
so much for having me, and I'm very glad to be, to have shared my experience and everything. Thank you.
absolutely. And thank you. And for all our listeners, how can they find you, your social media, your place of business? Because even if they don't have non-healing ulcers, they might want some of your aesthetic work. So
That's
give us
right.
the rundown on how to find and contact you.
I'm in Yakima. My office is in Yakima. I have a clinic, and it's called Oasis Healology Clinic. Healology. It is the process of healing. So I made up the name, the word healology, because it is the goal is to heal. So it's Oasis Healology Clinic, and guess what? Some people just Oasis Healology. I'm like, no, 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 no. Don't butcher the word. Heal OGY. So
All
yes,
right.
look for Oasis Healology Clinic is here in Yakima, and you are welcome.
Yeah. And you got a podcast too. Let's talk. Let's share the way for them to find your podcast.
Yes, so the podcast, if you go to uihnf.org, is you find, I think it's to your right, the top right or to your top left, you find podcast and you just click it and you go, you can every Wednesday at 3 p.m. is the podcast. Actually tomorrow we have someone who's going to talk about weight loss.
Mm.
So she is in Yakima here, and you can see her like just a few months ago, how she has changed her body and her life. And she's gonna be here, she's gonna be there tomorrow, and we're gonna ask her how she did it. She did not use Ozempic, guys. She did not use anything. It's all walk out and eating right.
Mm. Okay. Well, listen. Very important stuff. I again thank you for
Thank
coming on
you.
the platform,
Thank you.
and let me tell you how special I feel. You're a very busy person. You're a very busy person, and
Yes.
you have carved out for your own mental wellness that Wednesdays is your podcast days.
Yes.
But just for me, you said, "All right, Leroy, you bugged me enough. I'll give you a couple minutes on a Tuesday." So I want to extend my thank you for carving out some time on a
My
busy
pleasure.
day.
My pleasure.
And cheers to future collaborations and conversations and learning. So for everyone here listening, Oasis Healology. Hopefully I didn't butcher that.
Yeah.
Oasis Healology. We'll come back again with some more of her expertise. Until then, keep reading, keep listening, keep learning, and we'll talk to you soon.
Thank
Thank
you,
you.
Leroy. Thank you.